Lucas called me this morning. He had a mechanical issue with his Chevrolet truck. Told him he should have bought a Ford. And he's running about 30 minutes late. Had a Ford, he would have gotten here on time. And first of all, let me just kind of thank everyone that's been supporting this study committee, Legislative Council, Senate Press, Senate Research, everyone, and the police officers outside, by the way, that's been supporting this study committee. This is our final meeting. And the whole purpose, like I said from the very beginning, that this is not about taking away anyone's gun. This is not about Second Amendment. It's not about any of that. It's simply about trying to find a way to protect our kids from the senseless gun violence that is heartbreaking in our great state. And we have a long agenda today. And as I wrap this meeting up at the end, you're going to hear me say those same refrains again. And I am going to kind of focus on the things that are important to this committee and things that we've discussed throughout these previous 3 meetings that we've had. The agenda, and I just want to go over the agenda that we have. Hopefully everyone has seen it and had a copy of it. We are going to move things around a little bit because we have some parents that are here that we're going to allow to come first, because I understand that they have another engagement. We have a state representative from Utah that's going to be with us virtually. We also have the director of Texas Public Safety Center that's going to be with us virtually as well to talk about things that they're doing in their great state that hopefully can benefit some of the things that we're doing here in Georgia. And I'm going to ask if those that are presenting today, if they will just kind of keep their presentations going so that we can at least get by this calendar and this agenda that we set within an hour. Okay, an hour and a half. Certainly, I don't think anyone want to be here 2 hours to get through the presentation today. And certainly, Legislative Council and I have already been talking about some of the things that we can include in legislation going forward. And these are issues that I will continue to discuss with my colleagues that have been gracious enough to join me in this study committee and hopefully present legislation as we move forward. But as always, before I get started, I certainly want to recognize the members of our committee that is here with us virtually. And Chairman Harbin is there. I owe him an apology. He called me yesterday. I am glad to see you, by the way. I know down in South Georgia that you've been experiencing tremendous issues and trying to recover from Hurricane Helene. Thank you for being with us today. And I'm going to open the floor up to Senator Harbin. And I think I saw Senator Gann as well that's online with us. And at the appropriate time when Senator Lucas is here, I yield the floor to him as well. Senators?
Good morning, Mr. Chairman.
Good morning.
Frank Gann here. Once again, virtually apologize that our coordination on schedules just hadn't worked out, but great to be with you this morning and look forward to hearing from all of the speakers you have lined up.
Thank you, Mr. Chairman. Chairman Harbin.
Good morning. Thank you. Thank you. Sorry we didn't connect. We have been trying to get supplies in. We were flying over the weekend. I had people flying into Baxley and to Vidalia, taking diapers and necessary supplies in. And I've been working with Senator Tillery and Senator Hickman, just trying to work on that portion. So that's been kind of busy. I do have a meeting at 11:30. I'm gonna have to step away, but I'm gonna come back. But I will watch the recorded side of it from that standpoint. But thank you for what you're doing. And sorry we couldn't be there in person because we'd like to do that. And just as we work on this issue together. But you and I will connect by phone a little bit more later, okay?
Thank you. Thank you, Mr. Chairman. We're going to move forward with our first 2 presentations. We have Giovannia McDowell, Impact Parent in memory of her son. And we also have Miss Kristen Song, who's the author of Ethan's Law. And if you all will please come forward. I'm sorry, Ms. Song, you're here with us. Can you hear us?
I sure can.
Thank you. And as soon as we finish with our first presenter, we will call on you. Thank you. Ms. McDowell, we yield the floor to you. Turn
Greetings.
your mic on.
Can you hear me?
Greetings. Absolutely.
Okay. My name is Javanya McDowell, and I'm speaking today as a parent that has experienced the unimaginable. It is extremely difficult as a parent to say, I remember my son as, or speak of him in the past tense. Juwan was this kid full of life and love. He had a contagious laugh and infectious smile. His presence would light up a room. He was kind, generous, and sweet. He was also shy, but as a military family that often moved, it wouldn't take him long to meet others and make friends. He was an avid animal lover, very creative, and he loved to draw. He loved to play with his Lego sets and build them, which was a pricey hobby, but therapeutic. He often talked about his dream of becoming a veterinarian, and I would often joke and say, it can't be a family venture because I'm afraid of all animals. And he would say, one day. My husband and I often talked about which one of our sons would follow into his footsteps to serve our country. Our oldest ended up doing just that with 8 years and counting in the Navy. Our baby, well, it is a dream that unfortunately we're left to only imagine. Because on April the 7th, 2016, our lives were forever altered. It was a Thursday afternoon that we received a call that no parent should be on the receiving end of. Our oldest son told us that we needed to hurry to Savannah because Juwan had been shot. We later learned the details that Juwan had been shot and killed by another teen playing with an unsecured firearm while visiting family in our hometown of Savannah, Georgia on a spring break. The most painful task for our hearts was accepting that our son was never coming home. It is a pain that never goes away. Just thinking about the last birthday that we celebrated was March the 7th, 2016, in which he turned 14. And this past March, what would have been and should have been his 22nd birthday. But he will forever be 14. Our daily challenge for our hearts is living without him physically here. This journey never gets easy, and we are learning daily. We are committed to being intentional with telling our peers the importance of secure firearm storage, having this conversation with gun owners, non-gun owners, family members, friends, caregivers in the community, and how imperative it is to ask about the presence of guns in the homes before you allow your child to go to a sleepover or visit other homes. 2023 marked the worst year on the record when it comes to unintentional shootings by children. An overwhelming majority of unintentional shootings by children could have been prevented had the guns been securely stored, which means making secure storage of firearms and always inaccessible to kids and unauthorized users. I never would have guessed that this was the journey I was supposed to take. It isn't an easy one, and I'm still riddled with grief. But I have faith that by my words and saving lives, that's why I advocate for gun safety. To hear mothers and fathers and families say, I heard your story, and now I'm ensuring that our guns are secured. Or to hear them say, now I'm asking before I allow my child to go to someone's home to visit. It is necessary to save lives. I had lived through what could happen when guns aren't properly stored. It means grief, pain, and trauma. And I wouldn't wish it on anyone, whether it's a child finding a firearm and injuring and killing themselves, or someone close to them, or someone stealing it and using it to commit a crime. Sometimes I pull into the drive-thru of Juwan's favorite restaurant and I order his favorite meal, knowing that he would never eat it. But it gives me peace in the moment to say that it's for him. And then I pull on the side of the road and I see someone with the sign and I give it to them. Blessing others in the midst of my pain and grief helps my heart to smile, while tears are a constant companion. We had plans to sit on the front row of our son's graduation from high school and college. We had plans to walk down the aisle to sit on the front row of our son's wedding. We had plans to share tears welcoming our grandchildren. We never planned or imagined sitting on the front row at our 14-year-old son's funeral. We never planned or imagined walking down the aisle behind our son's casket. We never planned or imagined standing behind a hearse with tears streaming down as they loaded our son's casket in the back. We never planned or imagined sitting on the front row at the cemetery as they lowered our son's casket in the ground. We never imagined. And now our hearts are tasked with the unthinkable, the unimaginable of learning how to live without our son. Juwan was more than a number. And this is the issue that we all need to worry about. Whether it's your gun or not, it could be your child. I know firsthand how important it is to ask parents about guns in secure storage, wherever kids may be present, whether it's in a home or a vehicle. And that's my why. That's why I advocate for secure storage laws and the importance of the programming for the Be Smart. And I want to thank you, Chairman Jones, and I want to thank you all for having me here today and listening with your hearts, because you can't spell heart without ear. My hope and prayers is that we can reach across the aisle and be proactive to start with creating meaningful solutions to ending this epidemic and public health crisis, because our children deserve to live in a world free of gun violence and trauma that comes with it. Thank you.
Ma'am, thank you for sharing your story so passionately. I don't think there's words that we can share or I can share that would ever say some of the pain that you felt in your loss. But it's my hope that along with the members of this committee that we can move legislation forward that will save the children of many children in this great state as we move forward. That's the purpose of this committee, and you just summed it up better than I could have or even attempted to do. Thank you so very much.
Thank you.
Our next presenter, and you're more than welcome to stay here and join us while the next presenter come up and present as well. Yes, we have Ms. Kristen Song, Impacted Parents, the author of Ethan's Law, with us. Ms. Song.
Thank you. Thank you so much, and thank you for having me today. My name is Kristen Song, and I became involved in the gun violence prevention movement in 2018. On January 31st, I saw 2 police officers walking across my front lawn, and my heart sank. They wouldn't make eye contact with me. They just kept telling me my son Ethan was being rushed to the hospital. When my husband and I arrived at the ER, we were stopped by a social worker who led us into a tiny room where no sunlight ever reaches and where no good news is ever delivered. The ER doctor entered the room, slid down the wall, buried his head in his hands, and just whispered, "Your son is gone." And at that moment, all that I knew and loved and trusted imploded into a tiny million pieces. I fell to the ground and begged to see Ethan. I was the first to welcome him into this world, and I wanted to be the last to say goodbye. I never did get to say goodbye. I was told to remember him as he was. You see, my beautiful boy was shot in the head, and he was unrecognizable, even to my eyes. As I walked out of the hospital into the starless night, Ethan was being wheeled to the morgue. It was the first day of his death sentence and the first day of my life sentence. Ethan was killed in his best friend's home. The father, the gun owner, the adult in the home, stored his 3 handguns and ammunition in a shoebox. His son had been accessing the guns for over 6 months and kept his father's Glock under his bed. What is so heartbreaking is the gun owner could have saved Ethan in the time it takes to draw one breath by simply locking up his guns. Losing a child, especially when the tragedy was entirely preventable, is pure agony. Access to guns is the common denominator in the tragic deaths of our children. In my opinion, it is the leading cause of death among them. 76% of all school shooters use an unsecured gun from home or a relative's home to hunt and kill innocent. The majority of children who die by gun suicide use a unsecured firearm from home. And of course, the children who are killed unintentionally are also victims of unsecured guns. The goal of passing a safe storage law is to create a cultural shift. We want securing your firearms to become as instinctive and routine as securing your children in a car seat. I believe safe storage laws will have the most dramatic impact on reducing gun deaths in our children because they address the root problem, access to guns. There are nearly 500 million guns in this country, and the moment a child lays hands on an unsecured firearm, the first deadly domino falls. A suicidal child with a gun rarely has a second chance. It almost always ends in tragedy. A child who finds a gun could unintentionally shoot themselves, a sibling, a friend. A child who gains access to a firearm could become the next headline in a school shooting. Every one of these deaths, every shattered life, could have been avoided, entirely preventable, if gun owners took the simple, responsible step of locking up their guns. A safe gun storage law will have no impact on responsible gun owners in Georgia, as they already store their weapons properly. These laws are aimed at the other gun owners, like Colin Gray, who knew his son Colt was in crisis. Despite being warned by law enforcement to lock up his firearms, he did nothing. The moment Colt accessed his father's unsecured gun, it set off a chain of tragic events, leading to a devastating wave of heartbreak and loss. Mason, Christian, Christina, and Ricky would be alive today, but for Colin Gray's negligence. Georgia failed those killed in the recent high school shooting by not having a strong safe gun storage law in place. But you have the power to change that. This is not a heavy lift. With the technology and the biometric and PIN code safes, a gun owner can access his gun faster than he can open up his cell phone and dial 911. Sadly, these needless deaths will continue unless we start holding negligent gun owners accountable. When you take action, you will create a shift in behavior, and with it, you will give the children of Georgia the gift of a future. Thank you so much.
Thank you, Ms. Song, for that presentation. There's one thing that you said that will stay with me forever. And you said the work that we're doing is designed to create a cultural shift, and you are so correct. And that's exactly what we're trying to do with some of the ideas that's been presented during this committee these last couple of months. And it's certainly something we intend on doing with the legislation that we intend to introduce at the beginning of next session. Thank you again for sharing your story with us and your son's story with us. Thank you. We are going to continue with our agenda. And the next person on our agenda is going to share with us some of the things that they've done in Texas about creating an awareness program that has made a difference and a huge impact in the state of Texas. One of the things that we said early on, Megan, was Georgia, in terms of intentional and unintentional gun deaths, is at the top of the list in this nation. I think we're number 7 to number 8. Lauren, who's been my advisor throughout all of this, thank you. She's been feeding me these numbers. But Texas, I noticed, was down toward the bottom. And the first question I'd had to ask is, what are they doing that we're not doing in Georgia? And I'm hoping that from the presentation from our next person, Ms. Kathy Martinez-Prather, who is a PhD and a director of Texas School Safety Center. Ms. Prather?
Yes, sir. Good morning, Chairman Jones and committee members. Thank you for having me here this morning. My name is Kathy Martinez-Prather, and I am the director of the Texas School Safety Center at Texas State University.
Turn the volume up, please. Sorry.
Yes, sir. The mission of the Texas School Safety Center, which was established in 1999, is to serve schools and communities to create safe, secure, and healthy environments. The Texas School Safety Center is legislatively charged to serve as the central location for safety and security in Texas by providing training, research, and technical assistance to K-12 schools, charter public schools, and community colleges throughout the state. We serve over 1,200 school districts, 50 community colleges, and that encompasses over 9,000 campuses and approximately over 5.5 million students that are enrolled in our public schools. The Texas School Safety Center provides training and resources on a variety of topics, such as emergency operations planning, school behavioral threat assessment, drilling and exercising, the safety and security audit process, bullying prevention, substance use. We also train our school-based law enforcement officers that serve in our schools every day. Additionally, the Texas School Safety Center is charged to review every emergency operation plan for every school district in the state. We're charged to manage a safety and security consultant registry and develop model policy and procedures for schools to conduct audits. In 2023, effective September 1, Texas legislature passed House Bill 3, which included several added provisions around school safety in the aftermath of the Uvalde school shooting. In particular, the Texas School Safety Center, in collaboration with the Texas Department of Public Safety, was charged and is now required to provide each school district and open enrollment charter school district information and other resources regarding the safe storage of firearms. In turn, school districts across the state are now required by law to provide this information to the parent or guardian of each student enrolled in the district or school. Now, in 2021, there were over 4,700 pediatric firearm deaths in the United States, compared to over 3,300 in 2018. And between 2019 and 2020, the relative increase in firearm-related deaths among children under 19 years old was about 30%. And a contributing cause to this trend is the increased number of children that are exposed to unsecure guns in homes. In 2021, an estimated 30 million children lived in homes with firearms presented or that were present, and around 4.6 million of those children were exposed to firearms that were unlocked and in some cases loaded. Now, there are laws and policies that have demonstrated the ability to reduce firearm-related fatalities, and among those are child access protection laws, which apply consequences to firearm owners who fail to prevent child access to firearms through safe storage practices. And this kind of legislation is estimated to result in 22% decrease in firearm-related injuries within the states that have adopted these laws. Texas is one of the 26 states that have adopted a CAP policy. And then to directly support limiting child access to firearms in the household, Texas, as I've just mentioned, passed legislation that mandated that all school districts and the state to provide communication to parents and guardians on the importance of safe firearm storage practices. And to our knowledge, Texas is one of only very few states in the country to legislatively mandate and require schools to deliver this information to parents. And as Kristen had said earlier, the U.S. Secret Service reports that 76% of active attackers in schools used a gun from their parent or relative's home. And that further emphasizes the importance of safe storage practices, but also that schools can play an important role in helping to reduce gun violence by helping educate parents on safe practices. So when House Bill 3 in Texas was passed, the Texas Department of Public Safety already had an established statewide safe gun storage campaign called Keep 'em Safe Texas. And it offers free downloadable resources to promote safe gun storage. So we had a good foundation established already and weren't creating these materials from ground zero. But the aim here was to focus specifically targeting school districts with this information to get out to parents. That said, we worked with Texas DPS to develop an educator toolkit with those existing resources in place. But the aim here was to better package and assist school districts with presenting this information to parents in an understandable way. Part of this law also required districts to educate parents about the CAP law and the penalties that are associated with it. So at the center, we developed a sample letter addressed to parents that school district leadership could use and customize to their needs to help them present these resources in a more tangible way. These resources included talking points on how to talk to parents, how to talk to students, the community about safe gun storage. It offered information on different devices for safe gun storage. It also included downloadable presentations for adults and children, along with posters and flyers and activity sheets to help educate younger children on this very important topic. Now, in Texas, legislation does not currently prescribe the exact frequency of dissemination of resources by districts. So the center in our education efforts are strongly encouraging districts to disseminate this information multiple times a year, at minimum, at the beginning of the school year, before holidays, before major breaks, such as spring break, and at the end of the school year. In the 23-24 school year, we pushed out 8 statewide emails, 30 social media posts, reaching over 330,000 contacts. We will begin data collection through mandatory statewide reporting on safety practices that will incorporate district reporting on their compliance with this new provision in the new law, as well as their use of these resources that we have been asking them to disseminate. And then finally, we are also about to embark on a federally funded study to examine the early stage implementation outcomes in schools and self-reported behavioral and attitude outcomes among parents as a result of this messaging and dissemination of resources. The aim here and idea is we are on a path of continuous improvement. So we want to be able to utilize this as an opportunity to inform the development of additional resources, make enhancements to the existing ones to ensure that we are putting out the most effective and impactful message out there to change behaviors. So at this time, I'm happy to take any questions from the committee on the work that we have begun to implement here in Texas.
Dr. Prather, thank you. And I'm sure there are going to be a lot of questions from our members. And then I'm just going to get started with a few that I have, by the way. Tell me again how, what is the reporting mechanism for this particular department, and where are you all housed, and what agency and state government do you report to?
So we are actually housed at Texas State University. We receive a direct appropriation from our Texas legislature, and we are written into the Texas Education Code to serve as a central location for school safety. Now, when our organization started, the charge was very broad, but over the last 20 plus years, our charges have increased along with requirements for schools. So as school districts have requirements to enhance their safety and security posture, our role has been expanded to help support them. And certainly in the aftermath of Santa Fe, and Uvalde, our role has expanded. We do have a governor-appointed board of directors that are there to advise and guide us, and they represent multiple state agencies here in the state of Texas. So we have our state education agency, our attorney general's office. We also have folks that are appointed by the governor that represent all stakeholder aspects. So superintendents, teachers, principals. We have classroom, secondary, primary education. We have school-based law enforcement on our committees. So as you can understand, school safety is very multifaceted and very multidisciplinary. So having all of those perspectives to guide the work that we do and advise and inform is very critical. But we are one of 8 research centers here at Texas State University.
I am extremely excited about the work that you all are doing in Texas. And I believe that the organization and the structure that you have created would be beneficial to Georgia as well. What would you say to some of our legislators in the General Assembly about the organization that you currently direct?
Well, we've been in place for 20 plus years. And so I think what we have been able to do as a center is one, as a research center, our role is to make sure that all the guidance and the training that we put out is informed by the latest, best, and promising practices. But also working very closely with our legislature to help inform and guide that a lot of these best practices that were in place, 10, 15 years ago are now in law. For example, districts were required to have a multi-hazard emergency operations plan in Texas since 2005. But it wasn't until 2019 that we were charged, an entity was finally charged to actually review those plans. And that was very eye-opening for our state, and also just understanding where everyone was at in terms of how they defined what a quality plan was. And so it was a way for us to more strategically guide how we were educating schools on this process, because educators do not get into education to be emergency management coordinators. And so our role as a state and as an entity is to take this information and provide it in a very school-centric way for school districts. And so that's everything from emergency operations planning to how to implement school behavioral threat assessment with Fidelity. We do a lot of our work in prevention. So we are really working with districts to how do we prevent and mitigate, to how do we prepare for the most effective response. And so that's taken a lot of collaboration with our legislature, who have been very engaged in this issue, to really sort of move that needle to help school districts incorporate this. And I always say that, school safety has always sort of been a backseat conversation. And, we send our students to school to get a quality education, absolutely. But we also expect them to come home safe and sound. And so those two pieces now, I think, are critical to the discussions that we have here in our state. And it's taken time, but also just educating our leadership on what are the most effective practices that schools should be engaged in. But there's always more work to do.
And I know that just like here in Georgia, there's a lot of different groups that are advocates for safe storage and gun safety. Do you work with any of those other groups on the outside, or are you singly focused on research and working within the school system? And would that be K through 12, or is it K through college as well?
It's K through 12 right now, but yes, we don't work in a silo. We collaborate with outside entities. Obviously, we couldn't do this work alone, but it's really important that we're bringing in external stakeholders to help inform how this messaging goes out. As I mentioned, fortunately, Texas did already have a campaign in place, but now we're at a critical point, I think, where we really want to inform with data collection. How do we improve this messaging? How is it being received by parents? Another piece here is 1 year into it, how many school districts are aware of this legislation? We're putting out communications, but it takes a while to get this information out and make this a new norm for everybody. And so we're always on a path of continuous improvement as a research center to figure out what are better ways we could be getting this information out. I mentioned also that there is a piece that we would like to see sort of clarified, as you all move forward in thinking about how you're wanting to implement something like this, is to establish what those frequencies and that cadence needs to look like for school districts and how often they disseminate this information. I think that's important. We've also taken an opportunity with highly publicized events that have occurred around our country to push this information out. And so we don't want it to just be thought of as a one-time thing and it's done, check the list. This should be on a continuous basis and constantly improving. And to your point, measuring the effectiveness of how this is changing changing behavior.
Absolutely. Any of our members that are with us today, questions from any of our committee members? Well, I hope I didn't ask all of the questions. I am very excited to hear about the work that Texas has been doing. I've said it from the beginning. This is a program that I think we can model here in Georgia. And certainly listening to Dr. Prather here, I'm more excited about the opportunity to learn more about the work that y'all are doing and how we can integrate something similar here in Georgia. Are there any other members from this committee that has any questions? I see members on our line. If you do, raise your hand. If not, Dr. Prather, I can certainly say to you, thank you, and this will not be the last time that you were here for me.
Thank you, Senator. And I'm here to, if there's any other questions that come up, even after this hearing, I'm here to be a resource. Just thank you for the opportunity.
Thank you so very much. Appreciate you.
Yes, sir.
Hearing none, Senator, you okay? Our godfather that's here with us. Our next presenter, I'm going to ask if Chief Ron Applin will come up. He is with Atlanta Public Schools and their police department. One of the things that we recognize in this body, please come up and join us, Chief, is the importance of and the role of SROs in protecting the safety of our kids. And I am proud to have sponsored the legislation that Governor Deal signed into law almost 9 years ago that created this unique certification for SROs in the state of Georgia. Don't know if you knew that. And now that organization has grown. I know I spoke to Chief Kogard in Gaspro.
Yes, sir.
They have an organization and they're doing really, really good things across the state. And one of the things that I was encouraged with, Senator, was to hear during this tragic moment that we all witnessed in Appalachia High School was that the SROs neutralized the threat. And that was encouraging because that's the role that you all play in the school system. And that was one of the things that when I introduced this legislation well over 8-9 years ago, was ensuring that the SROs had the training that they needed, make sure they had the respect that they needed as well. And I am glad that Chief Applin is here just to talk to us about the role of SROs in school safety. Chief, is that big enough an introduction?
Yes, sir. That's much more than enough. Pretty much.
By the way, I am a graduate of Atlanta Public
Schools. I'm aware of that. I was made aware of that. Yes, sir. Yes, sir. I went to Harper High School. I graduated.
West Fulton High. 17.
All right. Okay. All right. So in that, I can talk specifically. I can talk specifically about Atlanta Public Schools and what we do when it comes to safety and security, and a lot of it is foundational and based on some of the training that we've gotten from the Georgia Alliance of School Resource Officers and Educators. We are part of that organization. I'm the vice president of GASRO, as a matter of fact. Mm-hmm. And when we started the department in 2016, the whole idea was to create a police department that would basically crush the school to prison pipeline at the end of the day. Mm-hmm. But we realized it was much more than that. It was much more than just crushing that pipeline. It was also creating and building relationships with our students. So much so in a way that when a student sees something or hears something, that they're comfortable enough to come to us and share with us any potential concerns or problems that they may see, so that we can get ahead of those problems. So what we really focused on what we could do with our officers to help them build relationships with our students, to make the environment in the school safer and stronger for them to be productive citizens. So we operate on what we call the triad method, right? So the triad is, if you think of a triangle, and in that triangle we have, in the middle is the officer, and one angle of the triangle is the officer is a law enforcement officer. We can do that all day. We police all the time. We know about that. We understand that clearly. But we also counselors and mentors. So when we think about that, we talk about interacting or engaging with our students. That's very important. Again, building those relationships, being able to create environments where students are comfortable coming to us and saying, hey, Johnny has a gun, or hey, Susie's, living outside in a car. Those are the things that we want to be able to create an environment for. And now we also prepare ourselves for the things that we don't want to have to deal with, right? The active shooter events. I mean, so we prepare our officers for that. We teach them and train them that they have to go to the threat. I'll just remind you, back in February of this year, we had an active shooter event at Mays High School, where 4 students were shot. And my officers ran to the threat. They didn't see them running away. We were looking at body-worn camera footage and watching their actions and how they responded. They responded the way that we trained them. That is something that a lot of people, is not natural. It's not natural to run to the threat for most folks, but these 3 officers who were there at the time did. And when I think about, I got to tie this into safe storage, because when I think about that, since 2018, we've recovered over 60 guns. Since 2018 in Atlanta Public Schools, 60 guns. And a majority of these guns were in the possession of juveniles who can't rightfully own guns. So where did they come from? That's a question you have to ask. Where did the guns come from? So, and tying that back into having SROs in schools, a lot of these guns, in some instances, we had occasions, like I mentioned earlier, Johnny has a gun. They shared that with the officer, and we're able to avert potential problems as a result. But there's one instance in regards to Mays, we had a young man who had possession of a firearm that wasn't his parents'. Don't know where he got it from, but he didn't purchase it, right? Mm-hmm. He couldn't purchase it. So, what do we do in that case? So any legislation that deals with safe storage of firearms, I think would definitely help us. I always say, when we think about safety and security in schools, it's everybody's responsibility, not just the police officers, not the teachers, not just not just the parents, but the community. And this is one way the community can step up and help provide a safe and secure environment for our students, is by safely and securely storing firearms that they have possession of.
Wow. I am excited to see the work that you all are doing. I know it's challenging. It's challenging.
It is.
One of the things that this committee is tasked with doing is trying to come up with legislation, if you will, that can assist the work that you all are doing in the school system. So when you think about the roles and responsibilities that we play, if you have any suggestions on things that you think we can do legislatively, that's always beneficial to us. Not going to ask you to put you on the spot now,
Yes,
but if there's something on your heart that you feel you had to say in that regard, please do. We're also looking at creating an organization or a culture, if you will, and you've heard one of our speakers mention that.
Yes.
That deals with gun safety and safe storage. And I know you all play an important role in creating that culture, by the way. When you mentioned triad, I was curious. I think of kind of a triangle with 3 different component pieces to it. And I just kind of jotted down some things, but tell me if you can expand a little bit further on what you mean by that triad, if you will.
Yes, sir. So as we think about one side of that triangle, as police officers, that's what we do all day. I mean, I've been doing this for 35 years. I know I look 45, but I've been doing it for quite some time. But that's what we do all the time. We can do that any day, anytime.
Sure.
But we do less of that, and we spend more time mentoring and educating our kids. So that's the other 2 sides of the triangle, is as a mentor and an educator. But we also, when we think about preparing our officers to be able to do that, now see, I used to be a SWAT commander, right? Before I got into this work, you know, I was retired from the sheriff's office, but I was a SWAT commander. And for me, every bad guy was a nail and I was a hammer. So I had to go through a transition to prepare myself for this. So, and that's one of the things that GASRO does a real good job of preparing officers to be able to deal with student populations. But so my progress and the things that I went through helped to prepare me to deal with student populations. But we also designed a program within our schools, within our training for police officers to prepare them for that. So when we think about the mentor and the educator, we prepare them with tools like, you know, restorative practices, social emotional learning, positive behavior intervention and supports, crisis intervention team. The crisis intervention team deals with recognizing disorders in certain individuals and being able to respond to that a little bit differently. Mental health first aid, so that we can recognize that when a kid is in distress or when the adult is in distress, and giving us tools to be able to deal with those things as we see them. So not just dealing with the tools around the belt, it's giving them tools up here to be able to interact with people in a way, especially students particularly, in a way that's a lot more productive, a lot more engaging, and help to reinforce a more secure environment for our students.
And at one time, I know SROs were not well received in schools. You know, there was some parents and community pushing that. We are politicizing our schools. We were bringing in law enforcement. And how have you all managed and to strike a balance, if you will, between those concerns from, let's say, we're providing too much policing in school to those who said there really isn't enough? How do you strike that?
And I would invite anyone to come into APS and you know, spend a day with an officer and see how they interact with our students. Again, we're not policing. I mean, we spend more time mentoring and educating than we do policing. Of course, we provide a safe and secure environment for our kids, but because of the training from GASRO, from organizations like GASRO, but also from training related to the things that I mentioned, the mental tools that we give officers to deal with kids, they're looking at their actions a lot differently. We recognize and we understand that if we put a kid into the criminal justice system, there's a great chance that they're not going to get out of it, right? It's a never-ending circle for them. So anything we can do to avert that is what we are charged with doing. So and whether that's by standard operating procedures, whether it's by our training, and whether it's by the standard that I set for officers who come on board with the department, that's what we look for, and that's how we're able to manage that. So we're doing a great job of reducing that funneling of kids to the criminal justice system. Sometimes we have to. Unfortunately, the 60 or so, and I don't know I can't say for sure if it was 60 kids with guns, but the 60 guns that were recovered, unfortunately, we have to refer them for potential criminal prosecution. But at the end of the day, you know, our goal is to try to find ways to divert them from criminal prosecution if we can.
There's been conversation about alert protocol, and we toss that word around a lot, by the way. But I'm trying to think of what kind of protocols could be put in place, rules promulgated by DOE that would make it easier for SROs and others, by the way, to identify students, young people that may be problematic, and to eliminate the possibility of them even bringing weapons into the school system. Yeah.
So unfortunately, we live in a world where we have to do certain things. And right now, well, some of the things that we're doing is we're screening students as they come into our buildings. We have to. We use metal detectors for that. We have a lot of things in place to monitor the things that they do, for example, on their laptops. We issue laptops to kids. We have a program called Securely. It monitors what they do. If a kid types in, how do I, you know, do a school shooting, it alerts our administrators, and we'll take action based on that. We have an anonymous reporting system. I think that another thing, I know the state has one too, but we have an anonymous reporting system, and that gives students an opportunity to share things with us if they have concerns. It can be anything from bullying to a possible school shooting. And when you think about that, giving kids the ability to report something anonymously, the Secret Service did a study after a few years ago about active shooter events, and they said 85% of the time someone knew something about it. So giving them a way to report it anonymously is another good tool to have in place. We have something, but I think when I talk to other school districts, we see different programs in place, and maybe having similar programs in place would be helpful. When kids go from one school district to another school district, being able to see some of the issues that the student was having at previous schools would help us get ahead of potential problems.
Sure.
Not to continue to put them on the microscope, but especially for us to be able to provide some supports if necessary to try to help them and try to, change them and keep them out of trouble going forward. So I said, just those are some things that I can think of right off that I think would be very helpful to support.
That is certainly on the list, by the way.
All right, perfect.
Very
Perfect.
toward the top.
Perfect.
The kids still use lockers in schools.
We stopped allowing kids using lockers in our schools. It's just you start storing items, from weapons to drugs to you name it. And so, we've taken a lot of steps to do things to try to deter them from doing those things. We do quite a few things.
Absolutely. Thank you, Chief.
Yes, sir.
Members of the committee,
Uh,
Senator.
when I was in school, the biggest game was the football team. And the football coach
Yes, sir.
ran that, and everybody, the teachers and everything else.
Yes, sir.
What do y'all do if there is a known gang member in the school? And do y'all periodically search lockers in the school, or do you have the permission to search lockers in the school?
Yeah, so we don't use lockers anymore in the school. When it comes to gangs, we were very intentional about that. We do know that, we have gangs, kids who are members of gangs who attend our schools. We know that, right? And so we brought on a gang intelligence officer to help us identify gang signs, gang colors and things of that nature, and also to coordinate with local police so that we can understand what kind of activities are taking place with regards to these gangs. Now, we're not just going into detecting gangs, but we also looked at ways of deterring kids from joining gangs. So we partnered with GASRO, the U.S. Attorney's Office, and GYPSTIC to put on a gang resistance education and training course. It is a research-based training course, one of the only ones that we've seen with regards to gangs, a research-based training course that gives officers the ability to go in the classroom and teach kids or give kids some tools that they need to help them, fight and resist gang activity. So we're looking at two fronts. Number one, three fronts. If you're involved in gang crime, criminal activity, we're gonna take advantage of the laws that were created to support prosecution of that. We're also going to figure out ways to try to identify gangs, and the third thing is try to figure out ways to try to help kids or give them tools to resist joining gangs.
Excellent. Any other questions from members of our committee, those that are with us virtually? Hear none, Chief, you've done yeoman's work here. I am excited to hear about the good things that SROs are doing in the direction that you all are going with the organization. It's much more professional, and this is just my opinion, than it's ever been before. And I certainly hope and pray that we are continuing to provide the resources to you all so you can continue to do the good work that you're doing.
Thank you very much. I appreciate it.
Love APS.
Yes, sir. Yes, sir.
Keep
Thank
our
you.
kids safe.
Yes, sir.
And I certainly appreciate Chief Applin for coming and presenting here today. Thank you, Chief.
Thank you very much.
Our next presenter is someone that serves as a state representative, not here in Georgia, by the way, but in Utah. And when I heard about the work that Representative Ellison was doing in Utah, I knew he was a person that we had to reach out to on behalf of this committee. and just kind of inquire with him, ask him, kind of request that he come and explain some of the legislation that they've introduced in Utah that I think may be beneficial to our great state of Georgia. So I want to introduce my cheat sheet here that been provided to me. Representative Steve Ellison, he is the House parliamentarian, and he's also a Republican from the Utah House of Representatives. Representative, are you there with us?
I'm here. Yes, thank you.
I will yield the floor to you. And thank you for joining us today. And we're looking forward to hearing about the good work that you're doing in the great state of Utah.
Great. Thank you very much, Senator. Can I share my screen?
Absolutely.
Okay, great.
Really.
All right. Can you see that? Are
Yes.
you able to see? Oh, okay. Let me from the beginning here. Okay. All right. I very much appreciate this opportunity. This is a suicide prevention, preventing school shootings and mass violence is an area that I've been heavily focused on. I'm in my 14th year and running for re-election currently, like probably many of you. So I'm going to move quickly. I'm happy to answer questions as we go. Just a little background. These are, of course, we know Columbine changed everything. These 3 women that I had a chance to visit with were all survivors of Columbine. Definitely used some of their input in some of the things we've been doing in Utah. These individuals, the man and woman in the bottom right-hand corner, both lost one of their children in the Parkland shooting. The 2 younger people above lost their sister in the Parkland shooting. These folks have all become advocates for change and have helped inform some of the policy that we've done here in Utah. The first bill I'm just going to touch on really briefly, and all the bills I've listed in this presentation, I listed what the vote was in the House, the Senate, who the sponsors were, and what the fiscal note was. And overall, you'll see that the bills are extremely bipartisan. This bill, which had a 0 fiscal note, was the first bill I ran back in 2013. And it required every school district to annually hold a parent seminar on youth protection. And the topics include mental health, suicide prevention, substance abuse, bullying, securing firearms. And we have a host of community providers that are happy to come and do these seminars in the evenings. I wrote the bill such that it wasn't a mandate, that they had to do it, but they could opt out. We've had 1 school district now in 9 or 10 years that have opted out of this because they had some other program. It's been extremely successful. I've attended a number of them myself. Again, in my opinion, low-hanging fruit, lots of community groups that will step in to help put on these seminars to educate parents of how to help their young people. This bill, as you can see, almost unanimous, created a voluntary firearm suicide prevention program that distributed trigger locks and a safety brochure called "Is Your Safety On?" This brochure and the trigger locks have been distributed through gun stores, schools, pharmacies. We've now distributed hundreds of thousands of trigger locks and tens of thousands of biometric safes. Again, a very low fiscal note. In 2014, myself and Senator Dan Thatcher ran a bill that created a school safety tip line commission. This was talked about briefly by the prior presenter. We just kind of studied, okay, how can we get a tip line going? Because we know that in most cases, actually 93% of the cases, a school shooter has leakage about what their plans are. And if you can ascertain that intelligence and head things off before it becomes a tragedy, it's so beneficial. So that led to the creation of a program called Safe UT. This program has been extremely successful in Utah. One thing that makes it so successful is it's a state-funded program that every school district and every charter school in the state has signed up for voluntarily. So it's coordinated through the Huntsman Mental Health Institute that's part of the University of Utah. Students can talk to a crisis worker 24/7, 365. Again, this is a licensed clinical social worker about school safety tips or threats. But what we found, while it started out as a safety tip mechanism, the vast majority of students use this for crisis intervention for themselves and for their peers. Again, strong support. We also rolled out a version, Safe UT Frontline, for law enforcement, healthcare workers, first responders. When we talk about those groups, a member of law enforcement is more likely to die from suicide from their own firearm than they are from an assailant's firearm. A firefighter is more likely to die by suicide than by fire. And the only cause of mortality that is greater for physicians than their patients is suicide. So we've had strong utilization from our healthcare and first responder community, where they can reach out for mental health assistance anytime, day or night, without worrying about their supervisor, finding out that they're looking for help because it's completely outside the chain of command. Safe UTNG, which stands for National Guard, is for members of the National Guard and their families. We know veteran suicide and active duty suicide is a huge issue, and we've seen great response from that, again, completely outside the chain of command. Utah is the national model for school safety and mental health tip lines because we have a behavioral health first approach. So many, pretty much all the states have their tip lines pointed towards law enforcement. Well, in Utah, it's pointed toward behavioral health officials and school behavioral health professionals and school officials. And that has prompted much greater use. Now, if a tip comes in related to a potential school act of school violence, we quickly coordinate with law enforcement, our state fusion center, and the principals, whoever needs to be involved. This data is a little bit old. It's in the prior fiscal year, but we had over 28,000 unique student conversations, 349 life-saving interventions. That an example of that is if a student is, I'll give you an example where we had a student that said, I'm standing on the edge of a train track waiting for the next train to come. In the terms of use, it says we can ping your location if it's a matter of life safety. They showed up, found the student standing, exactly where their cell phone pinged and saved the student's life. That's an example of a life-saving intervention. We have almost one of those a day. We had over 8,500 K through 12 and higher education tips. Our top 5 tip categories are suicide, either an individual, a student contemplating it, or seeking help for a friend. Number 2, bullying. Number 3, school threats or violence at 801 2 years ago. Some sort of crisis, some sort of mental health issue. Of those 801 school safety tips, the number 1 is guns in school. Number 2 is a planned school attack, assault, fighting weapons, explosives. In my own school district, a tip came in about 2 students planning to set off pipe bombs. The search warrant was obtained. The students were arrested, and completely assembled pipe bombs were found in one of their homes. So an early warning system is critical. Again, the prior presenter referenced the Secret Service report, averting targeted school violence. The number 1 key finding is that they're preventable when communities identify early warning signs and intervene. I misstated, I said 93%, 94% of school shooters have communicated their intentions with others. Of those communications, 69% were observed by peers and 31% by others. I won't belabor this, but we know that an early warning system is absolutely critical. Now, tying this back into safe storage of firearms, this is a shocking statistic. In around 74% of school shooter incidences, the firearm was obtained from the student's home or from that of a friend or relative. Now, in Utah, suicide is the leading cause of death for children and teenagers. And most of the time they get those weapons from their parents, from their homes, just like school shooters do. We're going to watch a brief video about that in just a second. Here's another bill. We had such success with the previous bill distributing trigger locks that we gave it ongoing funding and some one-time funding. We buy these trigger locks from the National Shooting Sports Federation for $1 a piece. As you can see, this bill passed unanimous on a bipartisan basis. The sponsor, my Senate sponsor of that bill is now our Senate president. Congress prohibited the funding of research related to firearms, but nothing to stop states from doing it. So this bill, sponsored by both a Democrat and a Republican, we funded a suicide prevention and gun data study. We had Harvard University Public School of Public Health do the study. We found that suicides outnumber homicides 8-1. 85% of firearm deaths in Utah were suicides. Metro counties had higher suicide rate attempts, but rural counties had higher rates of suicide deaths. The higher rate in rural counties was driven by a higher firearm suicide rate among all ages, including young people. This was a shocking finding. What percentage of rural use gun suicides are by rifle or shotgun, a long gun? 62%. So we passed legislation saying that all long guns, it's federal law that handguns have a cable style gun lock, trigger lock supplied with them, but it does not apply to long guns. So I sponsored a bill that said all long guns will also be supplied with a cable lock and that brochure about is your safety on. This one, so Utah has a very popular concealed carry permit. In this bill, we required that anybody applying for or renewing their concealed carry permit had to watch a short video on suicide prevention and the importance of securing firearms. And again, huge bipartisan support, unanimous in the Senate, very small fiscal note to continue that program. This was a landmark bill. The only thing I'm going to mention about this bill as it relates to this is we created an ongoing program called Live on Utah, which is a suicide prevention messaging campaign, which has been tremendously successful. The interesting thing is that in Utah, we actually have a CAP law, childhood access prevention law. It's quite weak, but the vast majority of people don't know that we have it. But when most firearm owners know that the gun that they purchased to protect their family, statistically, is the firearm that if a family member dies from a gun, it's going to be that firearm, that captures their attention. And then we try to educate them, but it's extremely preventable if you simply will secure the gun. Let's see here if I can get this video to run. This was a short PSA that we have been running in Utah. Let's see here. Here we go.
Mom, Dad, try to understand. Sometimes I'm going to be a little impulsive. Sometimes I'm going to be a lot impulsive. I mean, I'm a teenager. Like when I went through that really bad breakup. To you, it may have been no big deal. But to me, it was my whole world. It was my whole life. Remember when I got arrested? I actually thought that I would never be able to show my face in school again. And when that rumor about me started spreading all over social media, I thought it would never end. Like, I thought the only solution was for me to end. Not to freak you out or anything, but the leading cause of death in Utah for teens is suicide. And nearly half of those suicides are from firearms. And sorry, but they're usually yours. So help us out here. Because we may be impulsive, but we want to live. Almost all the time. But in case there are times where we forget, keep your guns and ammo locked up safely. Keep your guns and ammo locked up safely. Locked up safely. Because doing this little thing can make a big difference.
Okay, moving right along here. This bill, I think, was one of the most important bills that I've run. It's interesting that for years, and I'm sure you've all experienced this, when you're in school, they do vision screenings, they do hearing screenings, maybe a dental screening or scoliosis screening. But in terms of a mental health screening, that's just not been on the radar. So I sponsored this bill that required our State Board of Education to create evidence-based, age-appropriate mental health screeners that our schools could use for a voluntary screening program. It requires written parental consent, and it was voluntary. We now have about 90% of our schools that are using this program, and we've had thousands of students referred to treatment after the screening. We also know that, from detailed research, that every school shooter has some level of mental illness, trauma in their life. And so identifying those children upstream could prevent tragedy downstream. But also knowing that, school shootings account for a small fraction of young people killed by firearms. A huge number of them are from suicides. Intervening early to detect a mental illness is critical. Nationally, there's a 10-year delay from the time that mental health symptoms onset to when an individual is first treated. And so the goal is to help shorten that time frame and get children the help that they need. Another bill was Firearm Safe Harbor Amendments. This allows a cohabitant or an owner. Cohabitant may surrender a firearm to law enforcement. Requires a law enforcement agency to return the firearm to the owner upon request. Zero fiscal note, unanimous. This was huge in terms of domestic violence. We have so many issues of firearms being used in domestic violence. This allows a cohabitant to temporarily have that gun stored off-site. This is an interesting bill that, again, passed unanimous. $400 one-time cost. It creates a voluntary firearm restricted list that allows an individual to put their name on that list. They can either put it on for a specified time frame or indefinite. If it's indefinite, they can get off the list with a 7-day request window. We've had a number of people do this, and this is, I'll give an example. I know of a physician that had a patient experiencing mass suicide ideation or mass homicide ideation. This was before this bill passed. The physician expressed frustration because he didn't have a way to prevent his patient from obtaining firearms. Well, in this case, now that this bill's passed, the clinician could have said, hey, if you sign this form, it will temporarily prohibit you from owning or purchasing firearms. If you currently own firearms, we'll talk about how we remove those firearms from your home. And so, again, this is a very low cost and it's voluntary. It's really hard to argue with it. Our largest firearms group in the state supported this bill. And the reality is it helps save the lives of firearm owners. And a lot of cases, individuals with a serious mental illness that know they may be going through a cycle in the future while they're thinking more sanely, or somebody being discharged to an emergency room or a psychiatric inpatient stay can sign this form when they're in a better spot. So when they're in a darker spot, they don't have access to firearms. So in conclusion, state level legislation is making a difference. Of course, federal efforts are very often very contentious and generally remain stalled. We have seen our suicide rate in Utah for our young people and young adults decline nicely over the past 5 years. Knock on wood, Utah has never had a school shooting. However, it's not because people haven't tried. Because of Safe UT, we have averted numerous acts of school violence, which is our early warning system to reduce mass shootings and suicide. Efforts to reduce access to lethal means, particularly firearms, is one of the best ways to reduce suicide and mass shootings. This includes public service announcement campaigns like the Live On campaign and the short PSA that we viewed. If virtually all mass shooters are suffering from some type of psychiatric illness, the ability to screen school-age children for mental illness with appropriate referrals to treatment is a key strategy to prevent both mass school shootings and suicides. Lastly, training for mental health clinicians regarding access to lethal means. Counseling is critical, as well as tools to allow patients to put their names on a do not sell or possess registry to prevent both suicides and homicides. We have created something in Utah called CALM training. That stands for Counseling on Access to Lethal Means. It's really critical that clinicians, when they're talking to patients, do this the right way. If they say, hey, you know, a lot of people own firearms to protect their family, but what they don't know is that typically that firearm is the gun that may kill a family member, statistically, is the most likely gun by far to take the life of a family member. A lot of gun owners choose to lock up their guns and ammunition or temporarily remove them if a family member, if they have young children in the home, particularly if they are struggling with some sort of mental health issue. When presented that way, almost all rational firearm owners say, I did buy this gun to protect my family. Maybe I should take this simple step of locking it up to protect them from unintended use. So that concludes my presentation, and I am happy to answer any questions.
Representative Ellison, should I say Chairman Ellison, he also chairs he's the House Chair of the Public Education Appropriations Committee. He also serves on the House Health and Human Services Committee and co-chaired the Governor's Youth Suicide Prevention Task Force with the current Governor of Utah, Governor Cox. Representative, for a state like Georgia, and given our demographics, and of course, we've had a number of school mass shootings in our great state, too many to even talk about. And I'm looking at it, and I have a package of the legislation that you've not just introduced, but you've passed, by the way, and it is extremely impressive. Where would you recommend that we start in our great state on trying to curb some of this gun violence that we see in our school systems?
Yeah, thank you. It's a great question. So some of the most basic things I would recommend are the voluntary mental health screenings. The screenings are extremely accurate in indicating if there is a mental illness, you know, developing. The way I wrote the bill is it said that the schools need to work with the parents and healthcare professionals to then give the parents references, referrals to either in-school resources or external clinical resources to get their child help. That bill did have $1 million fiscal note that I added some of that later to help pay for children that maybe have a high deductible health plan or no insurance coverage if they're needing mental health treatment. That money is heavily utilized. You could still pass the bill without a fiscal note because that was just supplemental to help children that needed help. But in terms of parent groups that may oppose this, I approached our largest parent group and I said, this bill is about empowering parents to help their children. This is completely voluntary, requires the parent's signature. For parents who want help, why do we not give them that resource? In my own district, while they're only required to do it once, I think they're doing it 4 times a year because the demand and from parents for this service has been so strong. So to me, that's like low-hanging fruit. There's no reason we shouldn't be doing this. And number 2 cause of death for children in the nation is suicide. And it's so preventable amongst young people. So the other component that I think is absolutely critical is a statewide campaign where the state purchases trigger locks and distributes them to schools, libraries, pharmacies. Just this morning, I was on the phone with my friend in Florida, a physician that works for their Medicaid office. They currently have a request pending before CMS to make trigger locks durable medical equipment. You know, if you had a child with asthma or an allergy, an EpiPen or inhaler would be a life-saving device for that child. Well, if you look at the data, the number of children dying from unsecured firearms, I suggest that as we could flood the nation with trigger locks, that will save far, far more children than EpiPens and inhalers combined. And where they only cost $1, I mean, this is low-hanging fruit. And again, it's voluntary. Nobody's mandated to lock up their guns. And, you know, I'm not saying it's mutually exclusive with a safe storage law, but nobody's going to go and enforce safe storage laws. And to enforce them after a child's died by suicide is like adding just insult to injury for those parents. So educating them about the need of locking up firearms through public service announcement campaigns is critical. So that's the next step I would do is have a campaign to distribute trigger locks. But a huge component of that is educating the public why they should do that. And they will do it. We've seen it in Utah. The last thing I'd strongly recommend, and this is, I mean, Utah is willing to share our Safe UT platform with the nation and our know-how. I mean, it's an app. It's really a system of care because we coordinate so closely with schools, law enforcement, fusion centers, that having a child, giving the child the ability to talk to a licensed mental health clinician 24/7, 365 is extremely powerful. And they're our best source of intelligence about targeted school violence. The data shows it time and time again. People knew what that individual was contemplating. And if they say something, then our chances to avert it, it's the proverbial ounce of prevention is worth, tons and tons of cure. And so having a statewide system where if it's every school district has their own tip line and it's just a tip line, that's better than nothing. But even Colorado pivoted to replicate Utah's system after they saw the success of our behavioral health first approach with Safe UT. And it's really important to emphasize that with the advent of 988, which started from our failed efforts in Utah, me and Senator Thatcher tried to get a 3-digit number in Utah and failed. So we asked Senator Hatch and Congressman Stewart to run that in Congress, which they did. We now have the National Suicide Lifeline 988. Every state has 988 call centers. Georgia, I know, has a robust 988 call center system and mobile crisis teams and receiving centers. So we implemented Safe UT in our existing crisis centers. So we didn't have to go open a new building, buy new computers. We just had to hire some incremental people to work with students in crisis and submitting tips. So it could be seamlessly integrated into Georgia. Off the top of my head, those are the 3 easiest suggestions that, again, all of those have been done voluntarily in Utah. And we've had almost 100% uptake by all of our schools for mental health screenings, the trigger lock distributions, and the Safe UT program.
Well, I'm going to do something a little bit different this time around. And I know we have some members of our committee on the line, but we also have an audience out here listening and watching your presentation as well. So I'm going to open the floor up to members of the committee or any member that's out here with me today. Lauren, yes, I'm staring in your direction. And your colleague who works with you. Any questions from any member of the committee?
Let me ask you this. In doing this, how did you deal with your members who raised the question of the Second Amendment?
That is an excellent, excellent question. Glad you asked that. So when I first engaged in this work, I worked with a wonderful lady named Kathy Barver from the Means Matter Center at the Chan School for Public Health at Harvard University. She gave me some invaluable advice. She drew me 2 circles that kind of overlap slightly, kind of like the Olympic rings. And she said, Steve, one of these circles is the group that wants to melt all the guns down and get rid of guns. The other group is kind of the Charlton Heston, out of my cold dead hands, or you can take my gun, Second Amendment crowd. You all know what I'm talking about, the huge extremes. She said, these 2 groups have an area of overlap where these rings offset. She says, that is the culture of safety. They both agree in safety. She said, if you want to make a difference, focus on the area of overlapping agreement, which is the culture of safety. She says, if you want to make a lot of noise, dwell in either one of those circles that you want. But if you want to get something done, work in that area. So I reached out to our largest shootings firearm lobbying group in the state, Utah Shooting Sports Federation, and they worked closely with us on all of these bills. And they realized that working together, we can save gun owners' lives. And they also said, you know what? We realized that as we approach this from a public education, a voluntary safe storage perspective, that is not the restrictive bills that, the kind of Second Amendment community fears in terms of, prohibiting gun sales. I spoke last year at the American Psychiatric Association on preventing mass shootings. And one of the points I made is we have 400 million guns in America. 98% are in civilian hands. You could ban the sale of all firearms for the next century, and we still have several centuries of firearms on hand. So we can talk about that, but the reality is the guns are in the community. It's a constitutional right. So if we want to get something done, let's work together on the culture of safety and education. Because one of the worst things I've had to deal with in my life, and I've had to deal with it 3 times in my extended family, is when somebody finds an unsecured gun of another family member and takes their own life with that gun. The guilt and the regret is inexplicable. And so educating the public about this easy public health issue of locking up firearms is a message we can all agree on. And that's how it's worked in Utah. We've had strong support from our Second Amendment community.
My question surrounds I appreciate that you had a fiscal note on all of your, I don't know if you can hear me, sorry. I appreciate that you had a fiscal note on all of your bills. We don't really have a public health messaging campaign around safe storage in Georgia, and that will require resources. And I'm wondering if when you presented any of your bills that did require resources that, had a larger fiscal note, if you presented any information on the toll that gun violence takes, the monetary cost of gun violence at the state level, if that was a part of how you were able to get resources.
Great question. Yes, but we particularly focused on the cost in human life. So I worked with our state medical examiner that does the suicide psychological autopsy on all deaths, particularly young people. And we found that in Utah, which, little old Utah is just 1% of the nation's population. It's about 3.3 million people. But we found the number of youth, 10 to 17, that we were losing to suicide every year was the equivalent of 3,000 years of potential human life that was lost every year. And most of those deaths were from their parents' firearms. And so we quantified it in terms of years of human life that are lost. That resonated a lot louder than, well, this is how much we've lost from the workforce, from productivity. I mean, we know from the World Health Organization, mental illness is the largest cause of disability in the world. But when you put it in terms of human life, and it's the #1 cause of death, I didn't really have to back it up with any other financial statistics. And the overlay, the fact that suicide prevention and preventing school shootings, the tactics of preventing access to firearms and getting mental health treatment, they go hand in hand. So often when there's a tragedy of a school shooting, there'll be some voices saying it's all about the guns, other voices saying it's all about the mental health. The reality is it's some about both. And if you're not focusing on both, in my opinion, then you're not getting to the roots of the issue.
Well said. You have an audience full of people that's just shaking their heads, nodding with you. Yes, we agree. We agree. Any other questions? Speak now. In the back? Yes. Come forward some. And you can sit at the mic up here and I'll turn the mic on for you. It doesn't matter. I control all of them.
Representative, to get to what the lady up here was mentioning, in Georgia, we are a state that we have a constitutional carry law on the books. And so I think with us navigating through having a constitutional carry law on the books in Georgia, while also seeking, prevention of suicides by guns and as well as, gun violence, that I feel like is something that's a little bit different to navigate here, and I'm I guess this is a little bit of my ignorance, or maybe I just came in a little late. But do y'all have to navigate through a constitutional carry provision in Utah, or is that something that y'all don't have?
That's a great question. Thanks for asking. We do have constitutional carry.
Okay.
And in fact, when we passed that bill several years ago, as part of that bill, we allocated funds to educate the public about suicide prevention, because we knew that we were using that when people were having to get the permit, the concealed carry permit, they were having to watch that video on suicide prevention. And we realized fewer people would be getting the permit. And so we wanted to not lose the benefit of reaching firearm owners about the importance of properly securing firearms. So our legislature saw fit to allocate additional funding for that public messaging campaign. Now, it is interesting to note that our youth suicide number has continued to fall since we passed constitutional carry. And it's not, at least in Utah, we really haven't seen it make a difference. I think the general attitude here was bad people are going to carry guns whether or not there's a constitutional carry law or not. And so the reality is, whether you have the strictest gun laws or the most lax gun laws, the common denominator is educating the public about the importance of securing firearms and keeping them out of the hands of people that, you know, are struggling with a mental health issue. We even, our biggest firearms lobbyist shared this statistic. He said, if you are not involved in criminal activity, you know, cooking meth in the basement or something, the chances of somebody coming through your front door and shooting a family member, statistically, is about the same as being killed in a flash flood or an avalanche. It's just very low. But the likelihood of a family member dying from a firearm that's stored in the home to protect the family is happening almost on a daily basis. And so, like, if you're about statistics, then securing your firearms is where you want to put your attention. And that, you know, those times, that kind of data tended to resonate with the legislature here.
Thank you.
There's a mic at podium. If someone wants to march up to the podium and ask a question, feel free. This is kind of an open session now. Any other questions from anyone? Or Chairman Ellison, you've certainly given me some direction and some good information on a way forward. And I think that's what we're trying to find here in Georgia, particularly after the senseless gun violence that we've seen too much of in our great state. And I think it's high time to deal with some of these mental health issues. And I think in Utah, you found a way that makes sense without really impinging on someone's rights or trying to push too far against parental rights as well. And that's the one thing that I like about the legislation that you've done, and the many bills that I've seen that you have authored, by the way. And one thing that I didn't add is that Chairman Ellison has passed over 24 bills relating to suicide prevention and improving the lives of people with a mental illness in Utah. That's impressive in and of itself.
Thank you.
Expert opinion, because it really was expert opinion. And
well, if I may just make one comment on a comment that was made about funding for public service announcements.
Absolutely.
What we found in Utah is every one of these bills, the media has given it tons of free earned media in terms of free coverage. And actually our largest media outlet said, you know, we're going to pay for the mailing of trigger locks. And they ran a story, said anybody who wants a trigger lock, text, you know, your address to this short code. And in one weekend, they got 10,000 requests. And they said, we'll happily mail them out as part of this, you know, public health effort campaign. And I would think that in Georgia, you would receive the same response. So even if you had $0 for a public awareness campaign, this is the kind of story that the media is like, you know what, this is the area that we should all be able to agree on. So sorry, I just had to throw that in there.
Well, I agree with you, definitely. But thank you, by the way, and I hope you don't mind, as I was getting ready to say that, we certainly will be reaching out to you again as we move forward. And I hope you'll be open to certainly taking our calls as we discuss trying to put together a process, if you will, to change the culture of gun safety in Georgia.
Happy to talk. Thank you for the opportunity. I even contemplated flying down there, but with all my other duties, I appreciate the opportunity to be able to zoom into y'all.
Thank you again, and I look forward to the next time you're able to fly in with us as we start having our committee meetings in January. Thank you.
Great. Thank you so much.
Okay, it's okay to give him applause. Thank you again. Again, the purpose of this committee from the moment that we started it several months ago was to try and pull together a process, a series of legislation, if you will, that we can change this culture in Georgia. And I'm hoping that those that are present and watching online will begin to understand that it really is a multi-pronged approach. And it doesn't have anything to do with Second Amendment rights or open carry. It's all about education. It's all about, as the director in Texas said, creating awareness. And certainly, as Chairman Nelson just said, some of the things that he's done in Utah are just low-hanging fruit. It doesn't cost that much. So I'm hoping that this committee and committee members and our great state will begin to understand that as we move forward with trying to implement some of these ideas that we've gleaned from some of the presenters at this committee. Moving forward, I get off my soapbox now. And we are winding down on our agenda, by the way. Our next presenter is Miss Krista Cooper and Melinda Carson, school social workers for Georgia. Come on down.
Thank you, Chairman Jones, for allowing us to speak.
Absolutely.
Again, I'm in your committee. Again, my name is Melinda Carson. I'm a school social worker here in one of the Metro Atlanta districts. And I'm just here we had a presentation, but I'm here to talk about some of the work that we do as school social workers already that ties directly into the committee. I've heard a lot about mental health and trauma screenings. That is a school social work specific job. We do that every day, all day with our trauma screenings. Included with that are our behavioral assessments and threat assessments. A lot of times we found that students who were a part of the violence had already been screened and referred to services by us. Thank you. Excuse me. Thank you. So this is our vision, and our role for school social workers is to bring our expertise in student mental health and community dynamics. We help identify the challenges related to safe firearm storage, advocate for effective policies, and promote awareness about the safety of that. The roles that we have, early identification and intervention, which is a part of the mental health screening and trauma screenings that we do with our students. We do behavioral risk assessments and counseling and support. And what that looks like in schools is teachers or administrators or even parents identify their children and their students as a risk assessment. We go in with a specific diagnostic tool, and we serve that student. We'll refer them to mental health services, Georgia Crisis Line. We have a direct line to work with them and a direct protocol of how we work with them every day. And we also follow up with parents and students to ensure that the resources and the referrals that we're giving them are guided by. We also work with our school resource officers to report different areas or suspicions or threat assessments that we do with kids directly to them. And through our resource officers, they then collaborate with the community police that we have there. Crisis response and postvention. We as SWAG, what we call School Social Workers of Georgia, got together as a state organization and were on the team to develop the crisis response in Appalachia High School. So social workers from all over the state of Georgia went to Appalachia High School the week that they returned to provide crisis intervention. We also have a tiered level of services, which is the triangle that Chief Applin was talking about. On that basic level is where we do the in-school prevention services. They may look like town halls. They look like collaborations with our school resource officers and with our community police to engage students and parents in having events. So sometimes our local police will have a gun buyback event or prevention violence awareness event in the community. They collaborate with us and we give the information to our students and our parents to attend those events. A lot of times we do have to provide food or different trinkets, and we have to kind of come up with innovative ways to get the parents and students involved. A lot of times we bring them into the schools to provide these services. So I did want to mention that just like Dr. Prather in Texas said, that program had been around since 2005, but it wasn't until 2019 that legislation had been involved to sort of make it a streamlined process throughout the entire state. This is work that we do every day as social workers in schools around the state of Georgia to provide these services. And this is not the first time that we've approached legislation to be included in the prevention efforts in the state of Georgia. So some of the challenges and considerations that we are here wanting to collaborate with the community is that there is one social worker to every 2,475 students. If you think about that, the work that I do every day, it's only me. Every social worker has at least 2 or 3 high schools where we're responsible for not only every student, but the family. Doing this work does not only involve the student. We have to get the parents, the guardians, and everybody involved. There is a House Bill 851 or 855 that deals with foster care students. It directly specifies school social workers to provide that trauma support and those trauma-informed educational plans, because that is a population that is involved in traumatic experiences, and they understand that school social workers have that level of involvement and skill to work with them. Our homeless population is another large population that school social workers are directly tied to within federal legislation to work with and to provide these services to. So in essence, school social workers contribute to gun violence and prevention by not only addressing individual and family needs, but we also address the needs of the larger systemic issues that goes on in our system of education. One thing that Georgia did, we came to the legislation a few years back, and they have all not been successful as we would like it, but we learned a lot. One thing we learned the last go around is that we have to develop a system or a platform that can give us the data that we need to present to Congress. Our Georgia DOE, along with us in collaboration, have done that. We have a specific module within our education system, which is Infinite Campus for Schools, called SWARM, Social Work Assessment and Referral Module. You can tap into any time by collaborating with the DOE to see the number of mental health assessments that social workers have done throughout the state, behavioral assessment, threat assessment, homeless plans, traumatic plans, anything. You can see that directly within the state. And again, together, we're just here to create a more inviting environment for all of our students that are safe, that are already safe.
Thank you. Of course, you just raised a whole bunch of questions, by the way.
Okay. So I know that the last senator that talked, you asked him, where should we start? And the
Right.
first thing he said was mental health screenings in schools. School social workers do that. A part of the problem that we have is, again, it's just one of us to every 2,475 students. So we find a lot of our time on the back end reacting to crisis and traumatic events versus on the front end where you have proactive and preventative measures to do that. We've learned that school social workers throughout our advocacy efforts and approaching the Capitol, school social workers are listed within the quality basic education legislation as an indirect cost. We are now working with our partners and our lobbyists to draft legislation to be included in direct cost funding. That will automatically open us up. Right now, school counselors are 1 to 250 students. My high schools, I have 2 schools, high school and the elementary. My high school has at least 2,000 students. There's 1 social worker to 2,000 students, but we have 5 school counselors. So a lot of the work that we do, we have to train our counselors at the beginning of every year, every semester, into doing some of the things that we do so that we can have support in things that we do.
Tell me about the follow-up from the assessments that you all do. What follow-up is there for the kids that you may recognize need some additional services?
So there's different levels. The basic level of follow-up is we have a student who is identified as suicidal or homicidal. We will immediately refer them to our Georgia Crisis for support. Now, there are 2 levels to Georgia Crisis. The level that Georgia Crisis will take them in, provide an assessment. As a social worker, I follow up with the family to ensure this child is within services, to provide the educational support, and to be a liaison between the school and the resource or the referral source that they were connected to. If a child is removed to go into mental health hospital, we have it every day. Before they come back, the social worker is provided with the discharge plans, and we come up with a safety plan for that student in school. We also have students that are involved with the juvenile with the juvenile justice system. When they are released, we all are provided with that information from our juvenile court to, again, come up with safety plans and protocols that we include administrative parents and our school SROs on. We also give suggestions on whether that child should be back included, whether it's a mental health or a juvenile justice reason, back into the school environment, or should they be placed in the different environment that best suits their needs. So if a parent is not following up on the resources and the referrals that we provide, we do have to get in touch and collaborate with other entities such as the Department of Family and Children's Services to provide that support. For students that are already on plans within juvenile court, what it looks like as a social worker, I need to find out who the probation officer is to see how they can assist within the services and the support that we provide. So that's kind of the referral piece, but we also have students that we work with one-on-one or in group sessions, depending on where their risk level was when we initially provided that referral source. So it's just a lot of follow-up, a lot of providing the resources. We have to know what's in our community to be able to refer students and families that need the support.
Is there a process, and I'm sure there is, that you all use when you do your threat assessment of a student? But I'm thinking about not just in your district, but when you look across the entire state, do y'all coordinate with each other?
We as social workers, yes, absolutely. Monthly, we meet to kind of talk about our different processes, and we've tried to streamline the process over every district in Georgia. There are 180 school districts in Georgia. We've tried to streamline that process amongst social workers in Georgia. Now, there is a challenge because you have a rural district, which may look totally different from urban and suburban districts, but the flow of services that we provide, the assessment questions, and the referral services are streamlined by social workers, because that's a process that social workers are responsible for within our Department of Education in Georgia.
So you all operate under a mandate from the state, or is it a initiative under DOE?
It is a mandate from the state. We're also certified within the Georgia PSC to provide those mandates as well. So we're mandated to be that referring source. We have a workflow, a template, and pathways that we have those referral sources as well. And again, that's sort of in the realm of student support services. So you may see counselors also performing these because again, sometimes you'll have 5 counselors to that one social worker.
Sure.
But the social workers are the ones that are really trained in mental health versus a school counselor who is really the academic driven person in the school district versus the mental health services of that school.
How can you adequately care for a child when, as you said, roughly as one of you to 2,500 students?
We rely heavily on our community partners to be available. We rely heavily on our counties to provide the services and to have those agents and organizations in our districts to be able to refer to. Because again, just me, I can't do it all, but I need to have some for sure agencies and community resources around me that I can tap the family and the student into that could provide the service. And now I'm sort of a liaison, a follow-up with that agency to ensure that the student and the family is getting the services that they need.
You mentioned what we could do at the state level. Can you just kind of share with me again some of the things that you think we can do to help you and the other social workers and the work that they do?
Absolutely. So just the high level overview is that when legislation is drawn, when it comes to gun safety or firearm storage, we want to be specifically identified as a referral source and as a partner in the legislation, because sometimes, again, we're the ones that are trained within our graduate level work to do specifically this information. But what we've had to do is to sort of pre-train other student services staff to do the work because it's only a few of us. So to name us specifically within legislation will help us to get the numbers that we need and to help us with our pitch to legislation that social workers need to be included in direct cost funding versus in an indirect cost position.
And what's the difference?
The difference with the QBE, the Quality Basic Education Funding, is that school counselors are school-based and they're included within their direct costs. So there are, and there are other individuals that can speak specifically on that, but they're included in direct costs. Every school district has to have one counselor to every 250 students. And
what you're advocating for is more social workers. Is that correct?
Yes. And the way that we learn to go about doing that is for legislation to be updated, for us to be in direct costs instead of indirect costs. So if 100% budget, indirect costs may go to 15% versus a direct cost is 85% of that budget. If we are successful in our efforts, the number of school social workers will automatically increase throughout that funding formula versus right now what we're doing is having to go after specific grants in order to get the funding for us to continue this work as school social workers.
Makes sense to me.
Yeah.
I had to get you to say that, by the way.
Yes. Thank you. Thank you. Thank
You're
you.
welcome. Questions? Thank you. And I love social workers, by the way.
Thank you so much. We appreciate your time.
Sit on the board at my alma mater, SB Squared,
Okay.
School of Social Policy and Practice at my alma mater. Up
Okay.
in Pennsylvania, by the way.
Absolutely. Thank
And I've
you
been
so
on that
much.
board for 6 years.
Wow. Okay. Great information.
You're welcome. Thank you.
Thank you to the committee. I appreciate your time.
Yes, ma'am. Thank you for presenting. We have on my list, it appears to be our final presenter. Reverend Jones. Say again?
This one is a panel. Yeah. The one.
Oh, we have a panel.
Yeah.
Okay. Okay. Yes, the final will be Smart Program. But now we're going to have our panel to come up. Reverend Jones, Leonard Dungy, Vocan, I hope I'm pronouncing it correctly, Topali. Dr. B, that sounds good to me. Dr. T. He's a professor, Department of Criminal Justice and Criminology, Georgia State University, and the Metro Atlanta Violence Prevention Partnership. I will turn the floor over to you. I will yield to you. Please tell us about yourselves.
I'm a professor at Georgia State University in the Andrew Young School of Policy Studies. I study urban violence and urban violence prevention and policy. I'm also a victim of gun violence myself a few years ago, so I'm very familiar with the issues involved. A lot of the research that we do at Georgia State University around these issues has direct implications for legislation, so I was very gratified to hear a number of the people that you had up there talking about legislative solutions.
Mhm.
Our goal is to provide the research, the expertise that you need in order to make sure that that legislation works properly. And Leonard and the Hope Hustlers, which is a community-based violence prevention program that right now is operating pretty much metro-wide, but particularly in DeKalb County. We share a sort of a dedication to using a data-based approach to all things to make sure that if we're going to spend money, it needs to actually be proven that it works. If we're going to use resources, we want to make sure that they're being used properly since resources are not unlimited. And we have a number of models that are public health based that we use to implement the programs that we find helpful. Safe storage, by the way, is an absolute critical component of reducing what I refer to as violent mortality, because very often people who are killed by a gun in the home or a gun that a child found, for example, it's not an intentional form of violence, but it is violent nonetheless because of the way in which it affects that person and that person's family, who we refer to as co-victims of these events. So safe storage is absolutely critical. It is indeed low-hanging fruit. It is indeed backed up by science. And it's about one of the easiest things that we could possibly do in Georgia to reduce these kinds of incidents.
Again, my name is Leonard Dungy. I'm the Executive Director of Hope Hustlers, and we are a community violence intervention and prevention program. We've been recognized nationally by the White House for the work that we do here in the state of Georgia. I have boots on the ground. Half of my team, we have team members in the hospital who respond to violence, gunshot victims, and the other half is in the community. When I say boots on the ground, they're actually canvassing the community. We're working with the schools. We don't have a formal MOU yet. As again, Dr. V had said, we are actually implementing right now. We're metropolitan Atlanta, which means we respond to shootings all over, but we are concentrating right now on implementing the program formally in DeKalb County, and they're serving as an example for other counties in Georgia. But that recognition by the White House is basically through that bipartisan Safer Communities Act. And we are the CVI part of it, community violence intervention part of it. But we have been chosen. I was just at the White House 2 weeks ago for the executive order being signed by the president, where he made some enhancements to that law, and one of them being implementing that safe storage education, along with revamping the active shooter training that schools are actually going to get. So we're based in the community, but schools and courts are a very important part of what we do, because we focus on those who are at the highest risk of either committing or being victims of violence, and whether that be through the schools or the community or the courts. And so with that, we have a team of anger management specialists, grief counselors. We do stop the bleed training. We do CPR training. We also have DeKalb County has provided us with our own social worker. And so that we're trying to recreate that model through. And basically what we do, because we're working in the community, we're supplementing what the schools are doing, and we're supplementing what the courts are doing. And some of our participants do come from those areas. Some of them come from the hospital. Some of them just come from word of mouth, because my mother's been doing this work in this area for 20 years. So since, again, back to 2005, the work has been going on. This is just where we are today with it. So.
And when you say that you reach out to the victims,
Mhm.
how, what does that look like? Does someone call you? Do you have a tip or something?
A little bit of
And-
all of the above.
And once you reach out, what is the follow-up that you all do and try and ensure that that person is on the road to recovery?
Right. We're gonna start off with a hospital example. So let's say a gunshot victim comes into the hospital. I have hope officers who are in the hospital who administer bedside. They're not doctors, they're not nurses, but they are technically social workers in the hospital who make sure that not just that individual, that gunshot victim, but them along with their families are receiving whatever necessary resources that they require to live a quality life. And so that's the hospital response. In the community, sometimes, again, there's no formal MOU with the schools, but APS as well as DeKalb County schools have no problem calling us if they feel that there's about to be some violence in their school. And then we go with conflict resolution, again, anger management, and mentoring, life coaching. And so in the school situation, we would respond. 10% of what we do is actually responding to a shooting. So if something happens in Oakland City, we'll go to Oakland City and we'll have some kind of event to kind of bring healing and wellness back to that community. So that's the community response. The other response will be a school. So if there's something happening or something, a lot of times my team will have intel about something that's happening in the school. And vice versa. The school will have something. When my mother started this program a long time ago, we were in the schools, the communities, and everybody was fully funded. So now it's only partially funded. But the thing is, a lot of times the things that go on in school bleed into the neighborhood. And vice versa, things in the neighborhood bleed into the schools. So a lot of times we can interrupt or intervene in violent acts just because of the intel that we have for Hope Hustlers being in both locations. So I hope that kind of answered the question. We have been funded. We also now have an RV. So these mental health counselors, social workers, anger management specialists, and grief counselors will be able to go anywhere in Georgia. If we had it 2 weeks ago, we would have been in Winder because we're bringing grief counselors and social workers to that shooting response.
And where do y'all get the individuals that work with you on doing this work? How do you train them and where do they come from?
Generally, they come from the communities where they're the highest, I guess, number of violent acts. And so we want to recruit credible people from those communities because they have the relationships in those communities. And then we serve as a conduit for those people. And so the training is a national training. I just went through University of Chicago, Crime Lab, Community Violence Intervention Leadership Academy, which is where we graduated at the White House. It was 30 leaders from 20 cities. And they've actually just had the second cohort. So there's national training. This is based on an evidence-based model, part of it being the Cure Violence model, which is a national evidence-based model. And so we just have to adapt it for our individual states and communities. What works in Utah may work here, but again, this is a whole different demographic of people. So, I mean, we deal more with community and urban violence than they would, while suicides are, second. Violence in Georgia, especially in our local metropolitan Atlanta communities, is more urban violence. Even with the school shootings, it's more urban oriented than one single person.
Sure. Do you have an MOU with a particular system or do you work with the state DOE?
Well, we have a signed MOU with DeKalb County. We're working on the MOU for DeKalb County schools. And so that's in the process of being, so we can kind of get violence interrupters in the school to supplement the resource officers and supplement what's going on with the mental health, with the social workers in the schools. So one of the things I mentioned the last time I was here, an Office of Violence Prevention, a statewide Office of Violence Prevention will help coordinate everyone in this room and other programs that are not here today. It helps vet those programs. It also helps bring that Bipartisan Safer Communities Act to Georgia and allows us to funnel funding for all of these things that we're doing, because there is funding for everyone who spoke here today, the schools, obviously for what I do. So we have federal funding, but it's funneled right now through DeKalb County. Fulton, they're kind of catching on. They're working on it. No offense to anybody from Fulton here, but so it's taking off here in the state. But it's best for us to do it countywide, because even with metropolitan Atlanta, the city has 500,000 people. If it wasn't for DeKalb and Clayton and Gwinnett and Cobb and these other surrounding counties, that's where the other 5 million people live.
Sure.
So, and that's our approach. So I'm just really carrying on my mother's work, but
Who I've known for at
yeah,
least 10
exactly. So
years.
you kind of,
That's when-
we've been doing this for a minute here.
Yeah, I just wanted to add to that, the MOU that he's speaking about, that's a Bureau of Justice Assistance grant that went to DeKalb County. That grant is managed out of the Department of Human Services there, which I think is really important, because usually these kinds of things are either managed through a mayor's office or a police department. I think having it through Human Services opens up the number of partners that you can bring in
Sure.
to contribute to these kinds of efforts. So he's, what Hope Hustlers and Leonard are doing, just amazing work, boots on the ground kind of work, but they are able to then rely on the resources that are available to the entire county. So if they need information on geographical information systems, if they need to have information on zoning, if they need to make connections with the public defender, with the prosecutor's office, the school system, that department, because it has so many connections to other areas, can really help manage a lot of that relationship. They brought us in, for example, to do kind of the research side of things. And they're in the process of establishing their own Office of Violence Prevention, which I think would be terrific to have, but replicating that all the way up to the top and having one at the state level that has the expertise and the mandate to sort of help develop a statewide strategy would be really, really critical. Something similar to the model that my colleague at Texas State University was talking about, where you've got people who are applying that real world, boots on the ground kind of knowledge, along with the expertise and the support of the state. And then having them help to manage and establish offices of violence prevention at the county levels, so that those offices have a resource that they can go to other than the federal government to try and identify where they can develop the programs that are best for their counties. Safe storage obviously is one that would cover the entire state, but there are other ones I think Leonard alluded to where, this county might need more of this kind of help and another kind might need more of a different kind of help. He adjusts the training of the people that work for him to account for those sort of cultural differences. And we are trying to create culture change. I think that would be a really big part of what we're trying to do with the efforts that we're making.
It's a public health issue, and that's how we approach it. We're not replacing public safety.
Right.
We're here to enhance public safety, but it's a public health approach. So Health and Human Services are Mr. Prime, I guess, part of the legislature that we would work through in any case, whether it be in the state or the county level.
Yeah, in the same way that we don't that safe storage is not about opposing Second Amendment rights and stepping on those kinds of toes. Community-based violence prevention is not about replacing the police or putting them aside. As a matter of fact, it's about partnering with law enforcement. So you've got to have communities, law enforcement, and you have to have them working alongside the hospitals and the schools and some of those other areas. That's another kind of triangulated approach, but with government and community kind of at the center of things.
That's exactly what I was thinking.
That would work. In their examples, Maryland has an Office of Violence Prevention that they're setting up. As a matter of fact, they're in the process of hiring their director. North Carolina is another state. And there are other states such as Texas. They just don't call it the Office of Violence Prevention, but they're doing the same work. Texas is more school focused first. And there's nothing wrong with that. It's just we're community first, but that includes the schools and the police department and everyone else.
Sure.
And one last thing not one last thing. And if you have more questions, I'm happy to answer them. But I'm part of a group. A lot of the members are behind me right now, who have it came together this past year or so. A lot of it came out of the Metropolitan Anti-Violence Prevention Group that has a 10-point peace plan. It's very easily digestible. It has a number of components to it that I think match up nicely with potential legislative action. And I think that they have a copy of that they'd like to present. Yeah. To you folks and have you digest it and perhaps have a longer conversation later on to go through each of the points and talk about how they could be helpful to the state of Georgia.
Well, that's one of the things that as I've looked into the work that Texas is doing. That's one of the things that I noticed, that she kind of coordinates a lot of different resources in K through 12.
We mirror the Harris County, Lupe Washington, who's also a graduate with mine. She's from Harris County, Houston. And that's directly under her. And it's public health department though.
Sure.
They work through the hospital just like we do. So they've served as a good role model for us in implementing it.
Excellent. I think I get it. Thank you, guys. Thank you all so much. Dr. T and my good friend, thank you for that presentation. And I hope everyone is beginning to kind of see the kind of resources and commitment that's needed to this initiative. And clearly an awareness office and awareness initiative similar to what Texas is doing, I think is a critical component. And that would certainly be one of the recommendations out of this committee, because that office then can coordinate a lot of other resources that's needed, some of the work that you all are doing, and even apply for grants as well. So
it's a good example of bipartisan effort too, because you would not necessarily expect all that coming out of the state of Texas.
That's
if
correct.
People were stereotyping the state of Texas, they would not have expected it to come out of that state, and yet they're doing it. So.
And a lot longer than Georgia's been doing it. We're doing it, and I get it, but it doesn't seem to be as coordinated as some of these other states.
Right.
And some of the best practices that I've been able to see.
That's exactly right.
Utah had a different approach. They just legislated it.
Right. It's made it law.
Yeah.
Thank you.
All right. Thank you.
Thank you.
I know the day has been long, but I am not going to leave here until we hear from Diane Gregory and Miss Maggie. Is that Zettler?
Yes.
There with the Be Smart program. And I apologize for you all having waited so long. I was trying to get through this meeting and
Yes.
we're still close, an hour and a half. We're still close. Well, 2 hours and a half. We're still close. A lot of given information, and this is our last meeting of the year. And as we start our deliberations, I wanted to get as much information on record as I could, particularly with those that are here from our legislative branch, our Senate press that does all our reports, and of course, our research that our research office has been provided. You know, I'm doing the talking, but they're doing all the recording. And this information is critical as we put together something that works for Georgia, and that's my goal. And you all are a big piece of that.
Thank
So,
you for doing
thank you.
this. Thank you so much. And there's no apology needed, because I have also gained a wealth of information this morning, and it's been so interesting to hear what's happening in other states and how we can use that here in Georgia. So,
Thank you.
and I am going to try to channel my daughter-in-law, who is from, she is from Connecticut,
Okay.
and she talks very, very rapidly. So as I talk, you can read, and I'll try to breeze through this because I know we're all at that point. But thank you so very much for having me here today. I appreciate the opportunity to speak with all of you. My name is Maggie Zwettler, but you can call me Maggie Z. As we had Dr. V, I'm Maggie Z. And I'm a retired Cobb County teacher. I became active in the gun violence prevention movement after the tragedy at Marjorie Stoneman Douglas High School in Florida in 2018. I was drawn to the Be Smart program because it is a public education campaign. So it was developed to bring parents and adults together who are concerned about kids, guns, and safety.
The goal of the Be Smart campaign. It was launched in May of 2015, as I said, to bring people together to prevent gun violence and suicides resulting from child access to unsecured firearms. We do this by training volunteers who can start conversations with adults about gun storage in their communities and teaching others the 5 simple steps. When we speak to folks, we start by establishing common ground. And I've heard that referred to several times this morning. And again, that reference to the Venn diagram, that number one, we all want to keep our kids safe and see them grow up happy and healthy. Number two, we each have the right to make responsible decisions about how we protect our homes, families, and communities, including whether or not to have a gun in our home. Number three, if we can prevent even one child death or injury, it is our responsibility to do that. And as our elected leaders, we depend upon you to help with that. Okay, firearms, as we've heard many times, are the leading cause of death for children in the U.S. and Georgia. And I would like to qualify that by saying this is not true for every individual state in our country. But sadly, it is true for here in our state of Georgia. And it's a heartbreaking fact, as I've heard many people say this morning. This is definitely a public health crisis, and it needs to be addressed as such. So let's go on and see what some of our Georgia data here. This data is from the CDC and represents a 5-year average from 2018 to 2022. So in Georgia, each year, we have an average of 205 children and teens who die by guns every year. 28% of these children and teen deaths are suicides, 66 are homicides, and the remainder are unintentional shootings. So we can see we do have a little different issue than they have in Utah. So in addition to addressing the tragedy of suicides, we also need to look at our teen deaths that are caused by homicides. So I'm very grateful that that was also spoken of this morning. And a concern for all of us is the increasing amount of gunfire on school grounds, and it is increasing. And this, for us, sadly, came sharply into focus again as our tragedy at Appalachia High School last month in Winder. And as I won't read this slide because it's been quoted several times this morning, but the majority of school shooters get their guns from homes or their friends or family. On this slide, we show 4 tragic stories from just this year, and these are only 4 of many, sadly. In January in Macon, a 7-year-old boy unintentionally shot and wounded his 12-year-old sister. He found the unsecured loaded gun on the top of the refrigerator in his home. He thought it was an air gun. In February, a 3-year-old boy gained access to an unsecured firearm, pulled the trigger, and shot himself in the face. And sadly, there's a few other stories that have happened recently that are very similar to that. Totally preventable. In September in Paulding County, again, a 4-year-old girl unintentionally shot herself in the head and ultimately died. That was, I believe, after a few days in the hospital. So you can imagine what that family went through. And the gun belonged to her 20-year-old brother who had not secured it. And we've spoken about schools this morning. In Forsyth County, just this April, a 14-year-old brought a gun to Little Mill Middle School. So it's not just the high schools, we're seeing this in our middle schools as well. And fortunately, the SRO became aware of this and was able to intervene and prevent a possible tragedy. but we're seeing this way too often. So what we do when we speak to the public is we talk about what we can do on the first level, on the ground level, which is to be SMART. And our acronym spells out our program. S, secure all guns. M, model responsible behavior. A, ask about guns in other homes. R, recognize the role of guns in suicide. And T, tell your peers to be smart. So when we talk about secure guns in homes and vehicles, we make it clear to parents that we're not just talking about hiding a gun. It is locking your gun, or better yet, having it in a safe. And we actually bring with us, when we do presentations, when we do tablings in the community, gun locks to give away. Also, examples, and we model how to use a very inexpensive lockbox, and also nowadays a very inexpensive biometric safe, less than $100. So again, people are interested in this, and they very frequently take our information. We can supply them with a QR code that they can order right off Amazon on the spot. Okay, our M is for model responsible behavior. And the key here is that we are talking about adult responsibility. It is not the responsibility of the child to get themselves away from guns when they see them. It is the adult's responsibility to make sure that a child cannot access those guns. Also important is the A, ask about unsecured guns in other homes. And this is actually the #1 eye-opener that we have from, especially of parents that are not gun owners. It has never occurred to them to ask about the presence of guns in other homes. But tragically, we heard the story this morning from both Giovanni McDowell and Kristen Song about what happened to their sons in the home, in other people's homes. So I always tell parents, if you feel awkward, because we get a lot of feedback, oh, I could never ask about that, because we have such a stigma around firearms, unfortunately, in our area. So I say, well, just tell them your pediatrician told you to ask. And we've partnered with pediatricians, and I've never been told, don't say that. They're like, yes, say that. And sadly, we also have to talk about the R. Because of, we have to talk about the role of recognizing the role of guns in suicide. And we know that access to a firearm can mean the difference between life and death. Most people who attempt suicide do not die unless they use a gun. 90% of suicide attempts with a gun result in death. This is a much higher fatality rate than any other means. And it's also a little known fact that 70% of people who do survive a suicide attempt, meaning they used a different method, never repeat an attempt again. They get the help, they get the intervention that they need, but access to an unsecured firearm doesn't give that child or teen that second chance. And we have, again, 41% of child suicides involve a gun. It's important that parents know that children can be very impulsive. We saw that in the PSA that they're using in Utah. Sometimes parents don't realize how impulsive their kids can be. And a bad day at school can trigger them. I hate to use the expression trigger, but can trigger them into making a decision that they cannot come back from. Also, many parents just don't understand when their children are having a depression crisis. Sometimes it's hard to distinguish between a child in depression and a normal teenager. And those of us that have raised teenagers know what I'm talking about, you know? So for all those reasons, it's crucial that the parents keep their firearms securely stored. Our last letter is T. Tell everyone you know to be smart. And I generally challenge the audience to think of 3 people in their lives, in their community, that they can give this message to today. So I hope all of you here can also do that. Think of at least 3 people in your lives that you can share our message with. And last of all, I did include a slide. Actually, Diana provided this for me, a slide relating what we've been talking about with secure storage and the impact that it has had on states that do have secure storage legislation on the books. And you can see that secure storage reduces youth gun violence dramatically, with households that lack firearms and ammunition seeing up to 85% fewer unintentional injuries. It's also reduces guns being stolen, as we were talking about today, as well as suicide. So definitely there is a positive impact from legislation. So thank you so much for allowing me to speak with you today. And here is my contact information as well. I have brochures, cards, and if you would give these to the committee members who couldn't be here today, I'd appreciate that. My contact information is back here. We work closely with APS. We are so fortunate to have a wonderful partnership with them. And we appreciate the pediatricians in our state, the medical community who have stepped forward to get the message out, as well as schools and other community partners. And again, thank you so much for your time.
You're welcome. Thank you all for your presentation.
I just want to, a couple of the things there, the A, and they're asking, we're so used, my kids are all grown now, but you would go over and like, do you have a swimming pool? Do you have a dog? Are you allergic to red dye? But these are things that can 90% of the time can kill you. And then recognizing the role, I've raised 4 daughters and they're not here, thank God, but they are very hormonal when they're teenagers and they love you to death when in 1 minute and then the world is in crisis the next. And one of my daughters, the youngest one now, she was definitely suicidal all through high school and stuff, and would have been diagnosed as manic depressive and could have made that, you know, that instant decision. So we were on top of her watching with drugs and stuff like that and other medications. But if a gun had been in the house, her manic depressive behavior was just in her ADHD, just could have been a quick, unfortunately not coming back from.
Absolutely.
Which doesn't just affect her, affects me, affects her siblings and everybody around it. The sphere of people affected by suicide is just, it's just enormous. And then everything got covered that I want to cover except for just, and you're probably familiar about this, that Memphis and Atlanta, Georgia are the top for stolen weapons from cars. And we're about 14 points away from Memphis right now. I live in Midtown Atlanta, so I'm very familiar with the break-ins. But on an average, at least one gun is stolen from a car every 9 minutes in the United States. And most of these guns are put back to the underground and unfortunately get into the hands of undesirables. And I think it was the APS police officer talked about if they weren't getting from home, they can't figure out where these guns are coming from, but they are coming down through, you know, through the ground from them being broken into in cars.
Right. And a very inexpensive lockbox will secure a gun in a car. And
Yeah.
there's actually some that fit right in the console. So
They
it's
can
definitely
recover.
worth $20 to save your gun and save a life, more importantly.
It's like bolted right under, I think they make it for every single vehicle now too.
Couldn't agree more. I couldn't agree
Yeah.
more.
And in DeKalb, she mentioned DeKalb, a 2-year-old, unfortunately unalived himself last week with his father, and a $67 biometric safe on Amazon. That's your child's life for $67. I would love to find, and I've talked to Angela, who runs Moms to Me in Action. She was just here in Georgia this weekend, about trying to get some sort of grants that we can do income-based, because I know even $67 is a lot for some people to purchase. And if we can find some sort of grant that would help fund people, I'm sure people want to save their children's lives. And a simple biometric that they can never get into, thumbprint. It's our families, friends, neighbors, children, everybody. That's it. I could talk forever. I really could, but I know we've been here a long time.
Well, thank you. Thank you for that presentation, and I'm very familiar with the Be Smart program.
Yeah. Thank you so
Wonderful.
much.
Thank
for-
you so much.
Absolutely.
Glad
Appreciate
you
it.
are.
A lot. Yeah.
Any more? But that concludes the list of presenters. And any of our committee members that are here with us still, any questions from any of our committee members in terms of wrapping things up? Now would be the time to speak. Since you asked, please, absolutely, come on up. Any other committee members, by the way, before? You're going to be our last guest. Go ahead.
Thank you for allowing me to speak. With what I'm going to say, is not really much of, I think she said it's the safety committee or the gun control. But to be honest, right now, I feel like I want to take my life because of what's going on. And it's no disrespect towards anybody. I'm not a racist person. But I was raped by 2 white cops and they tried to take my life. And now they're trying to set me up by putting things in my food and beverage, not alcohol, because I don't drink, I don't smoke. I don't know anything about that. But it's like they're trying to make it seem as if I overdose on drugs or
Can I
something.
do one thing for you? Come on around here for a moment. I'm going to have somebody who's going to sit with you. If you can just sit right over there for a moment, please, while we kind of wrap things up. And yeah, right over there, please. I do want to conclude the comments for the study committee before we anyone that asks for help, I think it's incumbent on us to try and help. So, ma'am, just please bear with us for a moment. And my good friend, as we finalize our study committee, you have any parting words for us?
We need to do something about gun safety. We've had some problems. And the biggest question always comes about Second Amendment. And nobody's trying to do anything about Second Amendment. What we are trying to do is find a way to stop school shootings and keep kids safe.
Well, I want to go back to what I said when I started the committee several months ago. And it's quite apparent to me that here are the key issues that we need to focus on. And I've expanded my list, particularly after listening to some of the presenters. But I want everybody that's here and watching online, by the way, to remember that we have to focus on the CAP laws. And those are just the child access prevention law. That's critical to the work that we're doing. And I think it's critical to saving lives in the great state of Georgia. Another issue deals with alert protocol. I'm excited to hear that our superintendent of schools, Superintendent Woods, has expressed an interest in that. That's one of the reasons why I wanted to have the SRO to come and visit with us, so that we can kind of drill down a little bit deeper on what that protocol would look like. And I think I have a much clearer picture now of what that will look like. one of the key points that I want to make in these child access prevention laws is holding people responsible, civilly and criminally. And we are going to continue to, I'm going to continue to work on that. And you're going to see the legislation that's going to get introduced dealing with some of the civil and criminal penalties. There's several things that I've discussed already with Legislative Council that we're going to move forward with. And certainly if we could model a public safety awareness program, something very similar to what Texas is doing that can tie all of these resources together, Jenna, the members of the Senate press over there, I think we can put together a model program for the state of Georgia. So I don't want anyone to leave here thinking that where is this committee going to go? What I just shared with you is the direction that we're going to take the committee with our committee members, both Republicans and Democrats, as we pull together legislation that's going to focus on those key areas so that Georgia can have some of the best child access prevention laws on the books. And with that, as a wrap up.
Mr. Chairman.
There you are.
Yeah,
Chairman Gann, please.
I really appreciate the work that the committee has been doing and the testimony and stuff. One of the things that I wanted to comment, and unfortunately I had a phone call that messed up my connection, said when your police chief was speaking earlier in the meeting, but he said one thing that I want to make sure that we do, and that's where you've got a problem student with a past moving from one school district to another, that information follows that student going. If we know we have a problem, we need to make sure that the next school system has that. And that's where the student that did the shooting in Appalachia in my district, they came from the Jackson County school system and went over to Appalachia, and they cost the life of 4 individuals and injured 9 others. And, you know, I want to brag on my sheriff, Judge Smith, and all of the first responders that responded that day. But that's where, for me, I hope that in our committee work that'll be an important part of that, because the mentally ill, it's a something that we've got to fix, and we got to know about it so that we can protect our students and faculty.
Thank you, Chairman Gann. Any of the other committee members?
Yes, thank you, sir. Great job, great interviews. I think it makes us aware of what's going on. I think what Chairman Gann was talking about, I think we need to look at what has happened and what can we do in a proactive sense, whether that's metal detectors. And of course, some of the response time things happen because of other technology that we put in place. But I think we need to be able to respond to that and give the schools the resources they have, they need to help make those schools safe. But good job. I think good dialect. I think we look at what we can do to protect people without taking away their rights is what we are about. So thank you for the work you've done, sir.
Thank you, Mr. Chairman. We appreciate that. Any other comments from any of our members? And I just want to end up by thanking all of you, and Lauren particularly, for the work that she's put in this committee. I think I've already reached out to Senate Press. Thank you, by the way, for bringing all this together and holding us together. All I can say is stay tuned, more to come. Thank you and God bless you. This concludes our meeting.